Kylie, thank you. Well, Indiana University's Grand Challenges Initiative is working to solve pressing challenges with one focus in mind: to make life better for Hoosiers around the state. The Precision Health Initiative is one of 3 grand challenges at IU. Launched in 2016, it seeks to eradicate some of the most dreaded diseases faced by Hoosiers, including triple-negative breast cancer. IU says the research can help revolutionize the way clinical trials are being conducted for cancers around the world. For more on the Precision Health Initiative, pleased to be joined by IU School of Medicine Executive Associate Dean for Research Affairs, Dr. Tatiana Foroud, and IU School of Medicine Associate Dean of Translational Science, Dr. Sharon Moe. And ladies, thank you very much for joining us.
Thank you for.
Dr. Foroud, I'll start with you. I thought kind of a definition, if you will, of the focus of the Precision Health Initiative. I thought it was pretty good. Getting the right treatment to the right patient at the right time. That kind of seems to encapsulate kind of the mission. Expand on that, if you would.
Be glad to. So you're exactly right. That is exactly the goal. One of the challenges is you can't solve everything at once. So we've been funded since 2016, since we were announced by President McRobbie, and we've really made progress in 2 areas that I want to talk about today. The first is triple-negative breast cancer, as you mentioned, and also a childhood cancer, which is osteosarcoma. So I'd like to walk you through briefly how we've made progress both from the initiation from 2016 to now, and how we really see this as pointing to the future. So triple-negative breast cancer is one of the most aggressive forms of cancer, and it disproportionately affects African-American women. It's a cancer that we really need to have better treatments for and better ways to identify those at increased risk. So 2 IU investigators, Dr. Milan Radovich and Dr. Brian Schneider, have been working on this tough question for the past 5 years. And what they have found through the Precision Health Initiative is a blood test that they've developed that can be used in women who have been treated through chemotherapy and also through surgery. And by looking for tumor DNA inside the blood, they're able to identify those women who are more likely to remain in remission, and importantly, those women who are more likely to relapse, that is, to have their cancer return. And so this is very exciting because it, first of all, points us a way that we can identify women at greatest risk and also use this in the development of new clinical trials.
Yeah, in the childhood osteosarcoma, Tyler Trent, of course, brought a lot of attention from around the nation, around the world, really, to his courageous battle with that disease. That's another focus area.
Absolutely. So you're absolutely right. The contributions and the awareness that Tyler Trent has given us to this rare cancer called osteosarcoma has been really a way that we've been able to leverage the grand challenge. So the first is he donated his tumors that could be then studied by researchers, and a researcher at IU School of Medicine, Dr. Karen Pollock, has been able to identify a group of drugs that can be used to slow the growth of his tumor. And why that's important is that gives us new insight on how we could potentially treat other children and individuals who develop osteosarcoma. So we see that as a great new and potential advance for the future that we're focusing on.
Yeah, Dr. Sharon Moe, the Indiana Clinical and Translational Services Institute plays a big role here. Talk about that, because there are so many partnerships and collaborations that your organization has, the operation has around the state with academic institutions, with communities. It really is a statewide initiative.
Right, and that's why we call it the Indiana Clinical and Translational Sciences Institute, or the CTSI for short. And it's co-directed by myself and my colleague, Dr. Sarah Weehee. Excuse me. And our mission is very broad. Let's improve the health in Indiana. And our goal, really what we provide, is an infrastructure for investigators to succeed. So we provide pilot funding, training the next generation of researchers from high school all the way up through to medical schools, services, advice, accelerating innovation to the patient, and fostering the work done by researchers. So basically what we're doing is we're taking ideas that researchers may have in the lab, or different ways to deliver healthcare, different systems or methods or diagnostics, and we actually figure out how to get it to patients. And that requires a whole pathway of resources and experiments and studies and everything to get it there. And then once successful, we work closely with our statewide partners to implement these findings through our relationships. So this includes healthcare partners, the state community organizations. We have over 300 community organizations that work with us. But we also do the reverse. So we also ask our community organizations and our health providers in the state, what do they need? What do they need to improve the health? And so we take those back to investigators and we start all over. So it's really bi-directional flows of ideas, research, and solutions.
Yeah, very quickly, we only have about a minute left. But Dr. Moe, this obviously there's an impact on health, but quality of life, quality of place, if you will, around the state of Indiana. What we're talking about here, I think, has a direct correlation to that as well.
Yes, absolutely. So, I mean, the COVID-19 is a great example. It was an absolute crisis in the spring, and all of our IU sites, the state, the Reagan Street, all the hospitals came together to develop a dashboard. And then when we were short of PPE, protective equipment, we mobilized 3D printers across our state infrastructure, including IV Tech, and printed and distributed over 100,000 face masks and 50,000 face shields.
Yep.
We're doing a vaccine trial using our resources for the AstraZeneca. We collected blood and samples to help investigators figure out how can one disease give you a cough and a loss of smell and kidney disease. So there's a lot of puzzles to be answered. And so by mobilizing this infrastructure, we really were able to get at needs very quickly. And having that is really important.
The Precision Health Initiative, a lot more we can talk about on that. You're making a big difference around the state of Indiana. Dr. Tatiana Foroud, also Dr. Sharon Moe, thank you both for joining us, and we'll keep in touch. Hopefully have you on the show again.
Sounds great. Thank you so much.
All right.